All right, I'm going to be demonstrating a patellar taping technique that can decrease patellofemoral pain in a patient who may have excessive medial glide of their patella. Now, there are 4 different clinical predictor rules. The greatest that this taping technique is greatest is if they actually have tibial varus greater than 5 degrees and they have patellar tilt or an excessive patellar tilt. But the other 2 clinical predictor rules that this taping technique can be successful for is a dorsiflexion less than 15 degrees, and then calcaneal varus as well, less than 4 or greater than 4 degrees. So I have my patient here sitting with the knee extended, and with it in slight flexion, we can get a good indicator of how much medial glide she can have. Actually, I'm going to have you bend just a little bit, slide it more. There we are. And so here we can test that patellar tilt. We would go from pressing down on the medial side and tilting up on that lateral side. All right, so the taping technique is you anchor down that piece of tape and you glide that patella medially, and holding that medially, anchor it down. And you see that you may have some skin puckering. What we really want is that patella to have an increased J position for when they actually go from extension to flexion. Then we can anchor it down again, do that medial glide, and ensure adhesion. And if you have someone who has hairy legs, of course not a girl, but a male, make sure that they shave ahead of time because taking this tape off can be kind of painful. So that medial glide is increased, and so I would test them by doing functional activities by having them stand and do squat. And if there is decreased pain, then this patella taping technique is successful.